My name is Shazia Siddique. I'm an assistant professor of medicine at the University of Pennsylvania and a health services and health equity researcher. Today I'll be discussing our article in the Racism and Health issue of Health Affairs titled Racial and Ethnic Bias in Algorithms and the Impact on Disparities in Health and Healthcare, on behalf of my co-authors Dr. Hernandez-Boussard, Helen Burstin, Arlene Bierman, and Maia Hightower. Our paper calls for a transition away from race-based medicine and toward a race-aware approach to clinical algorithms. What is race-based medicine? It is when an individual's race influences decisions on treatment or diagnosis made by clinicians. Unfortunately, many clinical algorithms incorporate race-based medicine. This is problematic because race is a social and not a biologic construct, which has been supported through population genomic studies which have noted that there is greater genetic variation within a racial category than amongst them. Utilizing race-based medicine and algorithms ultimately uses race as an overly simplified and inadequate proxy for complex social and environmental factors. This has led to treatment patterns that are inappropriate, unjust, and harmful. Instead, we call for a race-aware approach to clinical algorithms, which acknowledges these complex factors, including structural racism. Fortunately, many clinical professional societies have already started to adopt a race-aware approach to revisit race-based algorithms. In order to develop a race-aware approach to clinical algorithm development, several steps are needed. First, we need to increase the diversity of our clinical trial populations to better understand and identify novel factors for which race may be a proxy. Second, precision medicine could be broadened to incorporate social and environmental factors that impact health equity. Next, further education and awareness is needed to tackle inaccurate assumptions about race and health. Finally, guidelines and policies are needed to enable culturally responsive care. This would allow for more comprehensive data collection to include social determinants of health that could be utilized to inform clinical algorithm development. These steps would help propel existing efforts to dismantle race-based medicine and promote health equity using a race-aware approach in clinical algorithms.